Today, we're diving into a piece of tech that is completely changing the game in dental practices, the intraoral scanner. For dentists, the question really isn't if they should go digital anymore, but how fast they can do it. So, what makes this decision such a no-brainer? Let's get into it.
All right, so here's our game plan. First, we're going to tackle that age-old headache, traditional impressions. After that, we'll jump into a scanner's core uses, the day-to-day restorative work, and even some advanced implants. Then we'll peek into the future with cosmetics and dentures before wrapping it all up with the huge payoff for a digital practice.
So, first up, the problem with impressions. If you're a dental pro, you know exactly what I'm talking about. For decades, this whole process has just been messy, stressful, and let's be honest, pretty uncomfortable for everyone. But the good news is, we are finally moving beyond all that. Does this look familiar to you? That goopy, uncomfortable impression goop, the patient trying their best not to gag, and of course, those cupboards just overflowing with heavy stone models that take up so much space. Yeah, this has been the reality for a long, long time, but it really doesn't have to be anymore. This quote just says it all, doesn't it? And this isn't some far-off futuristic idea. This is what's happening in clinics that are embracing digital scanning right now. The days of goop and gagging are officially over, and that marks a huge shift in both the patient experience and how efficient a practice can be. So that's the problem. What's the solution? Well, that brings us right into a scanner's core uses. This is where the magic really starts to happen, with the bread and butter of most dental offices: restorative work and orthodontics. The digital workflow for a crown is just beautifully simple. You scan the patient, you send that file to the lab instantly, and boom, they start making it. Gone are the days of waiting for a courier or worrying about a physical model getting lost or damaged. It's just clean, it's fast, and it is incredibly efficient. And hey, want to take it a step further? You can bring the entire production process in-house. Yeah, it's an investment in some CAD software and a mill or a 3D printer, and it takes some new skills, but you get total control. And it opens up the really powerful possibility of same-day dentistry.
And this isn't just for crowns. For orthodontics, a scanner gives you incredible freedom. You take one highly accurate scan, and you can upload it to basically any aligner company you want to work with. It makes treatment planning so much simpler and gets cases started faster than ever before.
Okay, so that's the daily stuff. But what about the really complex procedures? Let's talk advanced implant workflows. This is where a scanner's insane precision and simplicity really shine, turning what used to be complicated tasks into these smooth, streamlined processes. Now here's where things get really cool. You can take a CBCT X-ray and merge it together with the intraoral scan right in your software. And what does that let you do? Well, you can design and then print a surgical guide that is perfectly accurate. This just slashes human error and leads to safer, more predictable outcomes for your patients. And all that precision leads to unbelievable speed. Seriously, for anyone who has ever wrestled with a traditional implant impression, the idea of scanning and sending the case to the lab in just 5 minutes? That's not an improvement, it's a revolution. It's so much easier for the doctor and way more comfortable for the patient. All right, now let's shift gears and look towards the future. This is where we're seeing scanners move way beyond simple fillings and crowns to literally designing the entire future of a patient's smile. The digital smile design is probably one of the most powerful tools out there for case acceptance. You scan the arches, design the perfect smile, 3D print a little mock-up, and then transfer it into the patient's mouth with some temporary material. When a patient can literally see and feel their potential new smile, it completely changes the entire conversation about treatment. And it doesn't stop there. We are now firmly in the era of digital dentures. By combining scans with other info, you can design and then 3D print or mill a full denture. And with the materials and resins getting better and better every single year, this is quickly becoming the new standard. So all of this brings us to our final and maybe most important section, the digital practice payoff. Because when you add all these things together, you start to see why getting this tech is truly a complete no-brainer. Let's just put it side by side. Analog versus digital. Look at every single metric that matters. Patient comfort, no contest. Accuracy, digital, hands down. Speed, we're talking instant versus waiting for the mail. Lab communication, totally seamless. In every single category, digital scanning isn't just a little better, it's in a completely different league. So here's the bottom line. An intraoral scanner doesn't just change one little thing you do, it transforms your entire practice. Your lab communication gets better,
You open the door to new revenue streams, your chair time becomes way more efficient, and you offer a much, much better patient experience by finally getting rid of that awful impression material.
We've seen it. Scanners are faster, they're more accurate, and they're way more versatile than any of the old methods. The evidence is just overwhelming. The future of dentistry is digital. So the only question left to ask is, are you ready for it?